and you can start the presentation at your end. I suppose Dr. Piyush has already granted you the permission for sharing, so you can try once if you wish.
Yeah.
Great. So now, yes, they are visible. I suppose Dr. Piyush is
Yeah, Dr. Ashutosh, you're able to see the slides, right?
Yes. You can just move one or two forward or backward, so that will be, yeah. Great, sir. Great. So they are visible, sir. No lag, nothing. Great, sir. Great. Now, yes, they are visible. So as discussed earlier, sir, you will be delivering both in Kannada and English. And to a certain part, if you do not understand, we will ask you some few part to be in Hindi as well. If something of some request of some questions are like that.
Okay.
Of course, I'm already there in between, so we will try to manage the things in English only, but to a certain extent, if something is
Sure. So the session will be for 1 hour or?
yes, sir. A sharp 1 hour. We will try to finish the lecture part or your presentation by say 5, 15, 20. And then for 10 minutes, we will keep it for question answer. And if there are less numbers, then we will conclude earlier. But otherwise, the deadline will be 5:30.
Yes. Fine.
Dr. Ashutosh, we are live on YouTube website, and we have also posted on Facebook as well. So we can maybe next few minutes. It's 4:22 right now, so we can start in maybe next 5 to 6 minutes.
Great. But we have the scheduled time at 4:30, so let's start at 4:25 only.
No problem. And I also request to you, I think we know that after this, your company will be taking a bit break as far as these events are concerned. So some doctors were asking, and also some other state doctors were also waiting that. So maybe if you can discuss in the initial few minutes about your plans for other state doctors and other states, if you are doing maybe in December or January. So if you can have some insight, you can let us know. Otherwise, if that has to be decided, you can accordingly communicate.
I will convey that because that will take a few time. Great. Dr. Swas, I suppose now the cases are less in your college as well.
Yes, very few. We have only 2 or 3 cases now.
Okay. So
So we
how
have,
has been the experience of dealing these patients you have been
yeah,
seeing?
yeah. Like mainly we had only mild to moderate cases, most of them.
Okay.
But only thing is, though they become negative, but still there are so many post-COVID complications like
Yes.
fatigue, tiredness, muscle ache, body pain, then joint pains,
Yes.
respiratory difficulties. So there are and that is where the role of immunity will have a greater role to play to manage such
Yes, sir.
conditions.
Yes, you're right because I will just wanted to share one experience that there are two molecules only right now which are being recommended for lung fibrosis in India. One is a pirfenidone and another is nintedanib. So pirfenidone is a cheaper molecule in terms of say it has got efficacy as well, but it is cheaper than nintedanib. The cost of therapy for nintedanib is around 50,000. So of late, what has happened that from April onwards, both these brands are growing. Say by every month, they are increasing their sales by 2 or 3 crores. So we can understand that a lot of patients are coming from even from lung fibrosis. So this is something which is problematic in long run. So definitely that has to be seen what else we can do in terms of lung fibrosis patients if they end up because there is a possibility that a lot of studies which are saying that in the bandwidth of 4 to 24%, there can be a possibility of lung fibrosis in serious
Exactly.
patients.
But sometimes it is so difficult to understand because there'll be asymptomatic patients, but their lung will be having a lot of fibrotic changes. But in some cases, there'll be a lot of, there is no problem with the lungs, but they have severe symptoms. So, this is,
Yeah, well, yes, that genetic mutation part definitely that we can't say which person is susceptible and which is not. And even younger patients, I have seen few cases in which they are saying that they have to undergo an HRCT, although the patient was home quarantined only,
hmm.
and the symptoms are not relieving even after say 2 months, and the patient is taking a lot of medication, but still the things are not improving. So that is something which is unique in this particular disease. So it will unfold gradually. Nobody is sure what will be the outcome.
Yeah, yeah, yeah. So many new things are evolving out of this findings. No, like it's almost a new learning experience for everybody involved in this particular research.
Yeah, care system. Everybody has a new experience, and I suppose then the multiple specialty things will come into the play. That
Yeah, yeah.
every specialty has to play its own role in that scenario.
Exactly, exactly. I think the integrative model, what we speak about, no, is a
Hmm.
right option for the future. So we are involved
Uh,
in one such a large study of comparing ashwagandha with HCQ. It is sponsored
okay.
by Ayush, Ministry of Ayush. Uh,
Hmm.
it's a multi-centric study, and our center also happens to be one of such centers. And we have total 170 participants who have been recruited in last month.
Hmm.
In 85 patients, we are giving, they're not patients, in fact, they are the uh, COVID warriors, health
Hmm.
providers, as
Hmm.
tactic effect of HCQ in comparison with ashwagandha
Hmm.
we have been doing. And we have just started recruiting the patients. It's a 16-week study, and hopefully we should be able to come out with good findings out of this work.
So Ashutosh,
Okay.
we can start now.
Yeah, we can. We'll be starting. Good evening, everyone. Mankind Pharma welcomes you all to the live webinar on role of immunity during pandemic and beyond. Elixirs from Ayurveda. So today we'll be concluding the ongoing webinar series, which will begin on 12th of September this year with lectures from Dr. Prashant Tiwari. In this journey, we have included views and experiences of Ayurveda stalwarts like Professor Arun Gupta, Professor J.S. Tomar, Professor Yamini Bhushan Tripathi from BHU, Dr. Preeti Chabra, Dr. Jaishankar Mond, and Professor Harinder Mohan Shukla. So India has second most COVID-19 cases in world with a case fatality rate of 1.2% and demise of 1.26 lakh patients in the last 7 months. The war against COVID is far from over as in few cities in India are facing a second or third wave of pandemic. A gradual fatigue has set in our efforts against the pandemic, which will lead to rise in the number of cases and fatality. To guide us more on the necessity of immunomodulation, we have with us Professor Dr. Suhas Kumar Shetty, a renowned Ayurveda practitioner, teacher, and researcher who specializes in mental health, research methodology, and medical statics with experience of over 16 years. He has been speaker in international conferences, workshops held in USA, England, Scotland, South Africa, and Sri Lanka, to name a few. He has written 2 books and published more than 61 scientific articles in various international peer-reviewed journals and a recipient of Contingent Grant Award from CCRS. So I request all the attendees to post their queries in the comment box. We will be taking the question answer session once the talk of Professor Suhas is over. And I now hand over the session to Dr. Suhas. Welcome, sir.
Thank you. Thank you very, very much, Dr. Ashutosh. Uh, Let me thank mankind for this wonderful opportunity. I was happy to be associated with one more event a few months back, and very happy to be back again with one more event focusing on a major part of Karnataka. So ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಿಮಗೆ ಈ ಒಂದು ಸೆಷನ್ಗೆ it will be a great session that we will try to have, and I expect plenty of questions from the participants. ದಯವಿಟ್ಟು ನಿಮ್ಮ ಕ್ವಶನ್ಸ್ಗಳನ್ನು ಚಾಟ್ ಬಾಕ್ಸಿಗೆ ಹಾಕಿ. ಈ ಒಂದು ಚಾಟ್ ಬಾಕ್ಸ್ ಅಲ್ಲಿ ನಾವು ಲಾಸ್ಟಿಗೆ ತಗೊಳ್ತೀವಿ, and I'll try to answer most of your queries. So I'll keep my presentation for 45 to 15 minutes, maybe wind up by 5:15 or 5:20, and maybe we can have the discussion for 10 to 15 minutes. I request all the practitioners, teachers, participants who are attending this particular webinar to kindly post their valuable feedback and questions in the chat box so that this discussion and interaction will be fruitful. I also thank Dr. Piyush Juneja from Indian Vaidyas for again hosting this webinar and being coordinating with mankind for various events. I thank Dr. Piyush personally for this wonderful opportunity. And especially, I welcome all the participants and the delegates, senior faculties and practitioners for this very relevant topic that we have been talking about in current scenario on the role that the immunity has to play in the present pandemic, and much beyond that. And we may not restrict this particular immunity or understanding of the basics of the immunity only to the present scenario. It has been the basic concept which can help us to understand why different spectrum of people have different symptoms, why there are few people who have mild symptoms, why there are people who have suffer with very severe problems, why there is fatality rate in one section of the people. Probably the answer for most of this question would be that we have to focus on the concept or understanding of immunity. So we'll try to discuss briefly about the concept of immunity and how relevant this particular concept is in the current pandemic and much beyond this. And we may not restrict ourselves to only few of the drugs or herbs or therapies, but there are a lot of non-pharmacological therapies or even dietary lifestyle modifications, psychological measures, the mental empathy of an individual, how an individual looks at the perception of the disease. So all this will play a vital role, because many times we feel that the solution for our problem is from outside, or there could be some medicine or some pill which could be given and this could give us the solution. So in fact, the real medicine is within us. So being emotionally strong and being able to face any uncertainty or difficulty is a core crux of handling any situation. So as an Ayurvedic psychiatrist, I think it is the mind which can play a major role in handling the immunity. So it is not only the physical immunity that we talk about, but equally important is the psychological immunity that one should have to face many such problems in the present as well as the future. So I'd like to share the screen, and we'll try to go few of the concepts that we are going to discuss in today's presentation. I hope the screen is visible to the participant. ಎಲ್ಲರಿಗೂ ಕಾಣಿಸ್ತಾ ಇದೆ ಅನ್ಸ್ಕೋತೀನಿ ಈ ಒಂದು presentation. Okay. So the topic that we are going to discuss is a role of immunity during pandemic and beyond, elixirs from Ayurveda. See, if you look at the journey that has been happening, maybe early part of this year, maybe till January or February of 2020, probably everything was said to be very normal. People were moving very normally, and there was no any restrictions in the movement or in the general activity of individuals. So everything was going very, very normal. But probably in the early part of this year, maybe in the month of January, that is where WHO realized that there is an outbreak of a new corona disease called as COVID-19, and they declared it to be a public health emergency of international concern in January 2020. But it enlarged, or it magnified to such an extent that in the mid-March 2020, WHO again assessed the condition, and it declared that COVID-19 is characterized as a pandemic. So that is where it started affecting more than 180 to 200 countries, more than 200 countries getting affected with this particular virus. A lot of people getting affected with that, and the number of cases of death has gradually increased. So that is where the understanding as well as the role that can be played by various medical fraternity was really challenged. So if you look at the present scenario, how exactly the things are going on in the medical fraternity in the field of COVID-19, people are looking for various types of solutions. Every now and then we are hearing about vaccines coming out, or there are a lot of stage trials which are going on in different parts of the country for coming out with some form of vaccines. Newer drugs are being tried to combat with particular diseases. And even there have been a lot of repurposing of many available drugs to manage COVID-19. So that's the reason why there is enormous research work happening in forms of various observational studies, clinical trials happening. So definitely there is an urgency for immediate and pragmatic clinical response so that we can implement these findings to the common public. So sometimes we may not be able to wait till we generate the entire evidence, but it is, I think, the more relevant research practice at present would be to practice and experiences based on the people's different physicians who are doing wonderfully well, and based on their experiences and based on their practice and based on their knowledge and wisdom, probably we could come out with practice-based evidence rather than going with the evidence-based practice, which may definitely take some time. So everything needs to be documented, and we need to be implemented at a large scale. So as rightly pointed out in one of the editorial, that whichever suits best for the present scenario should be selected for the purpose of finding a solace to this problem. That is where various types of traditional medical system, maybe Ayurveda, yoga, naturopathy, Chinese medicines, had definitely gained a popularity among the medical system to combat not only as a prophylactic measure, but equally can have a major role in the management of COVID-19. And if you look at the traditional system, the main core or the main focus of most of this particular condition would be on immunity. And that is what we are trying to focus on today's discussion. So ಇವತ್ತಿನ ಚರ್ಚೆಯ ವಿಷಯ ನಾವು ನಮ್ಮ ಇಮ್ಯುನಿಟಿ ಬಗ್ಗೆ ಮಾತಾಡುವಂಥದ್ದು. ಸೊ ಈ ಇಮ್ಯುನಿಟಿ ಅಂದ್ರೆ ಏನು, ಇದರಿಂದ ಯಾಕೆ ಬೇರೆ ಬೇರೆ ಥರದ ಜನರು ಈ ಒಂದು ಇಮ್ಯುನಿಟಿ ಇಂದ ಬಳಲ್ತಾರೆ, ಯಾಕೆ ಬೇರೆ ಥರದ ಕೋವಿಡ್ ಪೇಷಂಟ್ಸ್ ಒಂಥರ ಸಿಂಪ್ಟಮ್ಸ್ ಮ್ಯಾನಿಫೆಸ್ಟ್ ಮಾಡ್ತಾರೆ, ಕೆಲವರಿಗೆ ಮೈಲ್ಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇರುತ್ತೆ, ಕೆಲವರಿಗೆ ತುಂಬಾನೇ ಸಿವಿಯರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಬಂದ್ಬಿಡುತ್ತೆ, ಯಾಕೆ ಈ ತರದ ಒಂದು ಎಕ್ಸಿಬಿಷನ್ ಯಾಕೆ ಆಗತ್ತೆ ಅಂತ ನೋಡುವಂತ ಇವತ್ತಿನ ಚರ್ಚೆಯ ವಿಷಯ. ಸೊ pandemic has not been very new for most of us. I think for the last two centuries there have been a series of pandemic very now and then, and it has caused various the death toll, and even millions of people have died. In fact, around 1.2 to 1.3 million people have died because of COVID-19. So probably the most important thing that we always look upon is the basic concept is immunity. So whenever we talk about immunity, so I request the participants to kindly, so what is that particular thing or word that comes to your mind whenever we talk about immunity in Ayurveda? So ಆ ಒಂದು ಶಬ್ದ ಏನು ನಿಮ್ಮ ಮನಸ್ಸಿಗೆ ಬರುವಂಥದ್ದು whenever we talk about immunity in Ayurveda? So ನಾವು immunity ಹೇಳಿದ ತಕ್ಷಣ ನಮ್ಮ ಮನಸ್ಸಿಗೆ ಬರುವಂತ ಒಂದು ಶಬ್ದ ಅಥವಾ what is that one word which comes to our mind whenever we talk about immunity? I request the participants to kindly put forward their feedback and in the chat box so that we can come to know what is your basic understanding and what is that few of the words that are very closely related with immunity. Yeah, I think many of them were telling Vyadikshamatva, Ojas, Bala, exactly, isn't it? Agni. So probably these are the basic concepts. So the most important thing is the Bala or the Ojas. So as you all know, the Ojas is the essence of the Sapta Dhatus, and it is basically important for the maintenance of health. So Ojas is something to do with the energy. It has to do with the positive energy that we talk about, the physical crux that we talk about in maintenance of health. And the Bala, which can be both the physical Bala as well, Sharika Bala ಮತ್ತು ಮಾನಸಿಕ ಬಲ, ಎರಡು ತರದ ಬಲವನ್ನು ನಾವು ನೋಡ್ಕೋಬಹುದು. ಒಂದು where it is more of a physical aspect, the other one is also the sattva or the psychological aspects. So again, there is different classification of the bala. So in the form of sahaja bala, kalaja bala, and yuktikrita bala. So in the modern also we classify immunity into innate immunity and adaptive immunity, isn't it? So that is where the sahaja bala, the innate immunity within genetically predisposed. But the thing is, this innate immunity will not have the memory for most of the antigens or the virus. Okay? But it is the first line of defense, but may not be. But if at all there is a recurrence of the attack, then there not be much role to be played by the innate immunity. But it is the adaptive immunity which can be enhanced by the dietary lifestyle, exercise, being psychologically connected, being socially connected, being involved in charity and kindness. Probably if we can help others. See, ಯಾವಾಗಲೂ ನಾವು ಬೇರೆಯವರಿಗೆ ಸಹಾಯ ಮಾಡಿದಾಗ ನಮಗೆ ಕೂಡ ತೃಪ್ತಿ ಆಗುತ್ತೆ, ನಮ್ಮ ಮನಸ್ಸಿಗೆ ಕೂಡ ಸಂತೋಷ ಆಗುತ್ತೆ. Probably this is very, very important. And as mental health professionals, it is very, very important that we are a part of this society, helping ourselves and helping people else. And for enhancing the yuktikrita bala, one can always restore to the dietary habits. See, diet like milk, ghee, amla, and I think one of the most important dietary, especially to build the immunity, especially the psychological immunity, which I commonly practice, is the Kushmanda or the ash god, Budgumbalkai. So we use this as the juice. You can use the juice of the pulp of the Kushmanda, like 50 ml twice a day with honey or sugar candy. for 4 to 6 weeks. It's a very good prescription. Most of the anxiety, depression, insomnia are related with the COVID pandemic. So this is a very good, what I've been, because we also have a COVID care center in our campus, and being associated with so many health clients, we found this to be a very good recipe. The Kushmanda or the Budh Gumbalkai, what we call it in Kannada, and ash god in English, we have to take 50 ml twice a day with honey as well, or you can take with sugar candy. And other types of therapies like Rasayana therapies and the Panchakarma therapies can play a major role. See, what we have been finding of late, that the post-COVID patients, though we say that they are negative, but they don't get back to the normalcy even after 10 to 12 weeks of their being positive. So that is where Ayurveda and other natural therapies can play a major role in mitigating such problems. It can be through the dietary lifestyle, and especially the Panchakarma, maybe Abhyanga, Udvartana, Murdu Virechana, Basti. So they all can play a very, very major role in counteracting with the basic complications of post-COVID complications. The basic concept of Vedic Shamatva is one where it can act against the disease force, and the second is that it will prevent the genesis of the disease. So that is what is called in Ayurveda as Vyadhi Bala Virodhitvam and Vyadhi Utpadaka Prativgam iti Yavat. So either it will not cause the disease, it will prevent the manifestation of the disease. If at all the disease has manifested, it will help in the early recovery. See, that is where even when we talk about the concept of Vikara, Vighata, Bhava and Abhava, as mentioned in the context of Prameha Nidana, that if a person has really that immune system, then either the disease will not manifest. If at all it manifests in a very milder form. Most of the symptoms may not manifest, and the person will be able to recover very faster. So that is the reason why maintaining your, and it's not a single day game that you start some therapy or some immune boosting therapy today and tomorrow you have got the results. So it's a process. And that is where all this should become a part of the habit, not just a part of a daily routine. So if it is brought as a part of the routine, then only it can have the beneficial. Doing for a few days like a medicine may not work when it is in terms of the diet and the lifestyle. So I think if a person follows this, he will have a strong physical health reflection, and all this will be the outcome of good immunity. And when it comes to I think the major role is played by the immunoglobulins. We always talk about the immunoglobulin profile in the present scenario, like IgG, IgM, etc., where IgM is a first line of defense which acts on the antigen, and whereas IgG is a secondary immune response. And the most important thing is it's the only antibody capable of crossing the placental barrier. So that is where it can neutralize the toxins and the virus. So understanding this is very, very important. And the pathology in terms of the immune system can be basically of three types. One, though, there is an excessive or overactive immune system, which is commonly seen in allergic reactions or hypersensitivity reactions. The second thing is inappropriate reaction to the self, what we commonly call as autoimmunity. And the third is the ineffective immune response, known as immune deficiency. So either there is a overactive immune response called as hyperactivity, inappropriate reaction to the self called as autoimmunity, and it's an ineffective immune response as commonly known as the immune deficiency. So why this immunity is important at the present scenario? Though we are looking for some outbreaks or some form of remedies in terms of vaccines and medicines, probably we are looking at a situation where vaccine may not be the permanent solution for any of such a pandemic. So it is important that we build our immunity. And it is more so important in country like India, because at present we are at the top two country having the most number of positive cases of COVID-19. So this is a statistics that was there in the late part of October or early part of November, that we stand on the second part. So who are at risk, ಯಾರಿಗೆ ಈ ಕಾಯಿಲೆ ಜಾಸ್ತಿ ಬರುವ ಚಾನ್ಸಸ್ಗಳಿದೆ? So those who are above 65 years, elderly people, young children, and those who are staying in a nursing home or a long-term care facility, or those people who are having comorbidity. And not only this, I think this can be, but it is very individualized, because I've seen patients who are apparently healthy, but if you look at their investigations or if you look at their chest X-ray, there's a lot of fibrosis happening. There are few people, if you look at the chest X-ray, there's severe fibrosis, but they don't have symptoms. So there's a lot of discrete differences among the patients suffering with COVID-19. So it is very, very important that we try to improve our immunity. So there are few challenges that we are facing at present scenario as per the present experiences that we have been finding out. That though patients become negative, but still there is a lot of remnant in the patients. And this is because of the persistent viremia. There are chances of relapse. There are chances of reinfection also. It's not that once you got this COVID-19, it's not that you never will have the complete immunity towards this. There are definitely the cases, though remote, in terms of the reoccurrence of the. So patient negative ಆದರೂ ಕೂಡ ಎಷ್ಟೋ ಸಲ ಪೇಷಂಟ್ಸ್ಗೆ ಅವರು ದೇ ಡೋಂಟ್ ಬಿಕಮ್ ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಪ್ರೀ ನಾರ್ಮಲ್. ಸೊ ಮುಂಚೆ ಥರ ಕಂಡೀಷನ್ಸ್ ಅವರಿಗೆ ಇರೋದಿಲ್ಲ. ಸೊ ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಬೇರೆ ಬೇರೆ ಥರದ ಕಾಂಪ್ಲಿಕೇಶನ್ ಉಂಟಾಗ್ಬೋದು. ತುಂಬ ಸುಸ್ತಂತ ಪೇಷಂಟ್ಸ್ ಇರ್ಬೋದು, ತಲೆನೋವು, ಮೈಕೆ ನೋವು, ಸೊಂಟ ನೋವು, ಅವರ ರೆಸ್ಪಿರೇಟರಿ ಸಿಸ್ಟಮ್ ಫಂಕ್ಷನ್ ಕೆಪಾಸಿಟಿ ಕಮ್ಮಿ ಆಗಿರ್ಬೋದು. ಸೊ ಹಾಗಾಗಿ ನಾವು ಪ್ರತಿಯೊಂದು ಪೇಷಂಟ್ನ ನಾವು ಅಸೆಸ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. And probably if we can give them some simple remedies or tips, I think it can play a major role in such conditions. And when the patient will have persistent or long-term suffering, they may suffer with various types of joint disorders, chest pain, fatigue, anxiety, insomnia, post-traumatic stress, skin rashes, vertigo, etc. So these are the complications that we are able to find out recently in the patients in our hospital. And there is definitely chances of the reoccurrence. So one should be very, very careful. See, that is where maintaining the immunity will play a major role. And there are a lot of Ayurveda also have been coming out with various types of interventions for different types of the problems. Like for unexposed patients, dietary lifestyle can be very, very important. For example, in patients who have exposed various types of medicines, this is the Ayush guidelines which has been told for management of mild to moderate conditions, right? And the most important thing is if the patient has severe problems, then the problem could be in terms of pippali rasayana, kantakari avaleha, chitrakadi avaleha, vyagri haritaki, etc. Okay. So in terms of not only these medications, but especially the washing of hands, the hand sanitization, the respiratory ethics, which have been mentioned in Ayurveda Dinacharya, which can play a major role in prevention of the infections, especially taking the bath using the neem water, doing the massage or abhyanga. Abhyanga ಮಾಡೋದನ್ನು ನಾವು ಯಾವಾಗಲೂ ನೋಡ್ಕೋಬಹುದು. It can always be very, very useful in terms of the real manifestations. And gargling, the Kavala Gandusha can be used very effectively. The Nasya, using Anutela, Shedbindu Tela can be very, very effective. And also the one should take care about the food habits and the dietary lifestyles. So these are very, very important for the, and the pandemic is not a new term for Ayurveda. We are all aware of this term called as Janapada Dvamsa. And Janapada Dvamsa is basically the different types of problems could be in terms of where it could be because of Vayu, Akasha, and Jala, Vayu, Jala, Desha, and Kala. So these are the different causes which can be the real cause for the Janapada Dvamsa. And for this, the different solutions are the Panchakarma, different herbs which have been mentioned, and of course, the concept of Rasayana. So Rasayana, as you all know, the concept which is very, very important. And I think some of the important Rasayanas which have been very, very beneficial in the post-COVID condition is Chavanprash, Leha. Then we have the Amalaki Rasayana, which is said to be very, very beneficial. The Brahma Rasayana, then Vyagri Haritaki Avaleha. So they are like you can take around 5 grams or 10 grams twice a day with milk or hot water, at least for around 1.5 months is very, very important. And many of the respiratory related disorders and symptoms can be easily been manifested, like Chavanprash, Vyagri Haritaki Avaleha, then Kantakari Avaleha, and we can also use Amlaki Rasayana. So that is where the immunomodulation will have a major role to play in the prevention as well as in the management of various types of disorders. So basically there are two types of immunity, the innate immunity and the adaptive immunity. The innate immunity, as you know, is through the natural killer cells, mast cells, and the basophils. And adaptive immunity is by the various types of B and T lymphocytes, T helper cells, etc. So the immunomodulation is a term which encompasses all the therapeutic intervention aimed at modifying the immune system. So immunomodulator may be defined as a substance, a biological or synthetic, which can stimulate or modulate any type of the immune system, both innate as well as the adaptive system. So they are very, very important to sustain the immune responses for the maturation of the non-specific and specific, right from children, young age and old age, and to enhance the local immunity. And especially when it comes to the COVID-19 and the immune system, it can have a greater impact on various systems, not only just restricting to the respiratory system. So, bari respiratory system mele matra idra parinama birudilla. Bere bere tarada ನಾವು ನೋಡ್ತಿರೋ patients ಗಳು ನೋಡಿದಾಗ patients can have a cardiac pathology, pathology in the kidney, pathology in the blood vessels also can be the cause. So it is not just restricted to a particular system. It is a generalized immunity which need to be addressed whenever we are talking about the patients suffering with COVID-19. So not only does it also invades the central nervous system. So it can enter and destroy the neurons, especially the medullary neurons can be. So that is where headache, nausea, vomiting, confusion, disorientation can also be the symptoms. We can see, we can able to see many of these patients who have encountered in our hospital where they have come out with this particular symptoms. So that is because that it can invade the neurons also. So there are so many recommendations by the Ministry of Ayush and Department of Health in terms of various medicines which are said to be very, very beneficial for the maintenance of the immunity. And I think one such effort from Mankind Pharma is developing a product called as ImmuHealth, where they have combined 6 major drugs from the list of the drugs which are said to be very potent in having the immunomodulatory antioxidant effect. So it's a combination which mainly has ashwagandha, then kalamega, guduchi, then it has amla, estimadu, etc. So it's a combination of this particular 6 drugs, mainly ashwagandha. It has a guduchi, kalamega, estimadu, tulsi, and amla. So there are a lot of evidences which are available regarding the various preclinical, clinical, and in silico studies that these medicines are very potent immunomodulators, antioxidants, antiviral, antimicrobial, anti-aging, and it can be used for various systems, especially the respiratory system. It can mitigate the symptoms related with the cold, cough, sore throat, etc. I think this is a very good combination that they have been able to come out with a product called as ImmuHelp. And coming to these products, the individual drugs that we are talking about, shortly I will try to talk about these drugs, especially the most commonly used drug nowadays in COVID-19, as supported also by Ministry of Ayush. Our institution is involved in one such a prophylactic studies where it is in comparison with the hydrochloroquine sulfate. There is one group where they're receiving this HCQ, and there's one more group where they're using 250 mg of ashwagandha twice a day. So this will be a 16-week studies. So initially we have recruited 170 patients, 85 in each of the group of the COVID warriors. The healthcare providers have been identified, screened, and they have been designated. And this is one such studies. So especially lack of energy, tiredness. I think ashwagandha is a very good prescription. Ideally, you should give in the dose of 3 to 6 grams twice a day. If you give for 45 days, it can relieve many of the tiredness related with the nervous system. I think this is one of the most preferred drug that we use in our hospital. You can use in the dose of 3 to 5 or 3 to 6 grams twice a day with milk for at least 45 days. Like most of the who has lack of energy, reduced sexual desire, premature ejaculation, so a lot of stress, anxiety. So this can be a very good prescription for these patients, because it is a traditional medicine which has a potent immunomodulatory effect. Even in some of the immunocompromised conditions like HIV, ashwagandha can be used, and it can definitely be very, very useful in declining the CD4 counts. And especially when it is administered, it has shown the enhancement in the phagocytic action of the peritoneal macrophages as compared with the controls. It can also have a greater role in the conditions like tuberculosis. It can act as an adjuvant to the anti-tubercular therapies. And it is said that there's a significant increase in the CD4 count in the studies when it is administered for 12 weeks. And many of the symptoms related with the pulmonary tuberculosis has significantly reduced when Withania somnifera was used as an adjunct to the anti-tubercular drugs. So this is a model which is very, very famous now, that that ashwagandha can play a major role by acting on these 5 axes. It can be a potent antiviral and immunoboosting drug. It can prevent pyrexia or the fever. It can have the anti-inflammatory effect. And very importantly, it can conserve the valvular space. The lung and the lung health can be improved by constant use of ashwagandha. And very importantly, the maintaining the vascular integrity. Because if the vascular integrity is maintained, there will be a proper blood supply to all the organs. And when it is used, it can be very, very potent. So idanna samanyaವಾಗಿ patient bartare tumba ಸುಸ್ತಾಗ್ತಾ ಇದೆ, and after suffering with COVID patients ಕೆಲಸ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ. ಸೊ ಅಂತ ಪೇಷಂಟ್ಸ್ ಗಳಿಗೆ 3 ರಿಂದ 6 ಗ್ರಾಮ್ ಹಾಲಲ್ಲಿ 15 ಇಂದ ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 3 ರಿಂದ 8 ವಾರ least 1 or 2 months ನಾವು ಕೊಟ್ಟಾಗ ಹೆಚ್ಚಿನ ಸಿಂಪ್ಟಮ್ಸ್ಗಳು ಬೇಗನೆ ಗುಣಮುಖ ಆಗುತ್ತೆ. So I think there is one more probable combination which is very, very useful is a combination of ashwagandha, guduchi and tulsi. So there is a lot of in silico evidences by using various molecular docking studies that this combination can have a great impact and can hinder the main protease of the COVID-19 virus. So next, of course, is guduchi, which is commonly used in various parts of the country. Guduchi is very commonly, especially Amritaballi. In Kannada, it is called as Amritaballi. In Sanskrit, Guduchi or Amrita. And because it has it is as effective as the nectar or Amrita. That is why it is been named so. And it is commonly available throughout the state of Karnataka as well as the entire part of the country. And it also has a great phagocytic activities and it can have an immune boosting effects. Especially, it can reduce the symptoms of allergic rhinitis. It can reduce the neutrophils and eosinophil counts to a greater extent. So if it is given in the form of swarasa, like 10 ml or 20 ml of swarasa, at least for 10 to 15 days, it can reduce acute allergic rhinitis, recurrent bronchitis, and especially to improve the liver health. It can be a very potent use. Especially it could, you should use either the leaf or it can use the stem. And if you want to use the stem, you can just crush it and you can make into decoction and it can be used because there is active ingredients are dominant in the stem of the Phenospora cardifolia. And it can also be used for the histamine-induced bronchospasm. Kalamega, very good, especially for the GIT tract. It can be a very wonderful drug for the GIT-related symptoms. Those patients who have a lack of appetite, ಸರಿಯಾಗಿ ಬಾಯಿ ರುಚಿ ಹತ್ತಾ ಇಲ್ಲ, ಯಾಕೋ ಒಳಜ್ವರ ಅನಿಸ್ತಾ ಇದೆ, ಯಾಕೋ ಸ್ವಲ್ಪ ಜಾಂಡೀಸ್ ಸಿಂಪ್ಟಮ್ಸ್ ಅನಿಸ್ತಾ ಇದೆ, ಮೋಷನ್ ಸರಿಯಾಗಿ ಹೋಗ್ತಾ ಇಲ್ಲ. ಸೊ ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ ಡೆಫಿನೆಟ್ಲಿ ಕಾಲಾಮೆಗಾ ಕ್ಯಾನ್ ಬಿ ಅ ವೆರಿ ವೆರಿ ಗುಡ್ ಡ್ರಗ್. ಸೊ ಕಾಲಾಮೆಗಾದ ಕಷಾಯ ಮಾಡಿಕೊಂಡು ಅಟ್ ಲೀಸ್ಟ್ 30 to 40 ml if it is given twice a day, at least for 15 to 20 days. It can definitely be deepana pachana and it can increase the appetite, normalize the functioning of the liver and other vital organs. It also can have a greater impact on the common cold and other related symptoms like sore throat, tiredness, etc. And a big, large randomized controlled trial has taken place spanning more than 33 such trials where they have shown that anticulus paniculators can shorten the duration of the cough, it can reduce the throat pain, and especially it can resolve it can reduce the sick time or the sick leave as compared with the normal usual care. It has a potent antiviral and the immunostimulation effect. And see, there are studies which have been done that when this Kalamega is combined with rifampicin, it can reduce the fatality rate. So that is very, very important in patients of tuberculosis. And also it can improve the cellular immunological indicators as indicated by RBC, WBC, and especially it can be able to modulate the innate immune response by regulating both the classical as well as the alternative activation of the macrophages and regulate the specific antibody production as well as antigen specific IL-4 producing spinocytes. So Tulsi, I think most of you are been using Tulsi either in the form of a medicine or in the form of Tulsi Tirtha because it's a potent anti-stress or stress adaptogenic. So this is the reason why whenever we visit the temple, we are being offered with Tulsi Tirtha to reduce the overall stress of an individual. Especially in cases of a cold, cough, running nose, I think especially starting from kid to the elderly, they always restore to the use of Tulsi because it is a Vata Kafahara and it is Krimihara, Vishahara, Ruchya, Deepana Pachana, and especially very, very useful for the pranava sroto vikaras. So you can give the fresh leaf juice around 10 to 20 ml twice a day or even thrice a day. It can be used, and root decoction 40 to 80 ml. And you can also make the powder of the seeds, which can be used in the dosage of 3 to 6 grams. So ಅದರ ಜ್ಯೂಸ್, ಎಲೆಯ ಜ್ಯೂಸ್ ತಗೊಳ್ಳೋದಾದ್ರೆ 10ರಿಂದ 20 ml ತಗೊಳ್ಬೇಕು. ಅದರ ಬೇರಿನ ಕಷಾಯ ಮಾಡ್ಕೊಳ್ಳೋದಾದ್ರೆ ಅದನ್ನ 40ರಿಂದ 80 ml ತಗೊಳ್ಬೇಕು. ಆದರೆ ಬೀಜದ ಚೂರ್ಣವನ್ನು ಉಪಯೋಗಿಸ್ಕೊಂಡಾಗ ಅದನ್ನ 3ರಿಂದ 6 ಗ್ರಾಮ್ ತನಕ ಉಪಯೋಗಿಸ್ಕೊಳ್ಬಹುದು. So it can be used very, very effectively. And definitely it can have a very, very major role to play, especially in terms of the antioxidant property, stress adaptogenic activity, especially where it can reduce the resistance against the stress-induced biological changes in animal models as well as in the clinical studies. It can also be a potent bronchodilator. The antitussive activities has been found with Osmium sanctum. One more very, very useful drug, especially for the diseases related with GIT, inflammation, wounds, etc., is Yeshtimadu or licorice or Glycyrrhizia glabra, which has a spectrum of its utilization, starting from the throat, eyes, GIT, and even in case of cancer, early cases of cancer, we commonly use Yeshtimadu Kshirapaka. 50 ml or 100 ml of Yeshtimadu Kshirapaka, if it is used, if it is at least used for 1 to 2 months, it can reduce most of the symptoms, the cancer-related symptoms, especially the esophageal cancer or stomach cancer or even the cervical cancer. It can be very, very useful. So this can also be used for the sore throat, cough, bronchial asthma, especially the upper respiratory tract infections. And most importantly, it can inhibit the growth of the virus, even including herpes simplex, varicella zoster, and influenza viruses, vesicular stomatitis virus, type A influenza virus. So all this can be mitigated, or it can reduce such virus inhibition. So that is where it can be used very, very effectively. So these are the very, very commonly available drugs, but highly effective and efficacious in most of the conditions related with the present pandemic conditions. And we have been finding wonderful results using this particular single drugs or in combination, or it can be used in various classical herbomineral preparations. So there have been various studies also that the extract or the active ingredients of the Glycyrrhizia glabra is a potent candidate for the management of COVID-19. I think amla, as we always mention, amla a day keeps doctor away. If it is used on a regular basis, I think it can be a very, very super antioxidant and the best drug that can be used as a free radical scavenging, and it can especially improve the immunity, both self-mediated as well as the humoral response can be very, very effective. So that's why it is called as Maharasayana. The best rasayana among all is Amalaki, because it is used for all ages, all seasons, and for all doshas. It can be used in the different permutation and combinations, and especially it is having the cooling effect on the body, and it can improve the immunity of a person. It can have an antioxidant, and especially lipid peroxidation activities is very much enhanced when this amalaki is used on a daily basis. So these are some of the references, and I would like to conclude with the perfect granny mantra that probably it's a time to focus on our immunity by some of the common practices that we can think of. So other than the medications or the herbal preparation that we have talked about, by using of ashwagandha, amalaki, or kalamegha, Yeshtimadu, etc., definitely there is a lot of role to be played by the dietary lifestyle, dietary modifications, So it is a time that we need to go back to the basics and eat the food which is prepared at home, nutritious food, and avoid plenty of junk foods, fast foods, bakery items. Definitely, this can do lot of the free radicals being present in the body. There is a lot of ama utpatti which will happen inside the body, and this becomes the cause for many diseases. So that is where eating regular food habits and doing involving in the physical activities. Because if a person is involving in regular physical activities, at least for 15 to 20 minutes, 5 times a week, if a person practices it, even the toxins can be metabolized by regular practices. Most importantly, being socially connected. Though we talk about physical distancing, but we need to be socially connected. This is very, very important so that we always have that support system, which is very, very core crux of the country like India. And the family support is also equally important, because I have seen families getting so much disturbed and going into a lot of stress whenever one person or anybody in the family or the entire family gets affected with COVID. So it can be very, very tough time for each one of them. But if I've seen even the family supporting each other, though they become positive, they have that positive energy and vibration within himself, which can be very important. And the care for the young people, care for the elderly, and whomever we can care. It's very, very important. So to conclude, that we should not just think that the immunity comes from the external world through various herbs or medicines or pill. It is through proper social support, regular understanding of the lifestyle, dietary consumption, and with lead expectation that the answer is going to come from outside. So the answer is within us, and if we can focus on this, definitely we'll be able to come out with positive immunity. And this could be the focus for most of our physical, mental, and psychic. So the diet and the lifestyle may need the central focus of the medical, mental, as well as the public health. So I once again thank organizers for this wonderful opportunity, especially thanking the entire team of Mankind and Indian Vaidyas for this wonderful opportunities. I think I have exactly stopped at 5:15, and we have exactly 10 to 15 good time to have discussion, because I assume that most of the participants are practitioners and learned audience. That's the reason why I didn't go with the basic concepts. Probably I tried to share few of my clinical experiences, is what has happened for few months, and especially about their product. It's a good combination in the form of Immune Help, which is very tried in various types of present viral conditions. So thank you once again for these wonderful opportunities, and I'm very eagerly looking forward for some active interaction by the participants. Thank you very much.
Uh, Thank you, Dr. Suhas, for such an interactive and informative lecture. I will just be taking few questions which have been posted by our honorable listeners. So, first question is that how we are supposed to manage COVID-19, post-COVID-19 patients through Ayurveda.
Yeah, see, the most
And
important.
just to disturb you in between, uh, as you go the ball, set the ball rolling. I will just request you to include Kannada in your answers, because a lot of audiences are from that particular area. So if we can just keep it to that particular.
Sure, sure, sure. ಸೊ ಇದೊಂದು ಕೇಳಿರುವ ಕ್ವಶನ್ ಏನಂದ್ರೆ, ಈ ಪೋಸ್ಟ್ ಕೋವಿಡ್ ಕಂಡೀಷನ್ಗಳನ್ನ ನಾವು ಆಯುರ್ವೇದದಲ್ಲಿ ಯಾವ ತರ ನಾವು ಮ್ಯಾನೇಜ್ ಮಾಡ್ಬೋದು ಅಂತ. ಪೋಸ್ಟ್ ಕೋವಿಡ್ ಕಂಡೀಷನ್ಸ್ ವಿ ಶುಡ್ ಬಿ ಏಬಲ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಯಾವ ತರದ ತೊಂದರೆ ಅಂತ ನಾವು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗತ್ತೆ. ನಿಮ್ಗೆ ಆವಾಗಲೇ ನಾನು ಹೇಳಿದೆ, ತುಂಬಾ ಸಮಯದಿಂದ ಕೋವಿಡ್ ಪೇಷಂಟ್ಸ್ ಬಂದಾಗ ಅವರಿಗೆ ಬೇರೆ ಬೇರೆ ತರದ ತೊಂದರೆಗಳು ಉಂಟಾಗ್ಬೋದು. ಒಂದು, ಅವರ ಒಂದು ಬಾಯಿ ರುಚಿ ಕಮ್ಮಿ ಆಗ್ಬೋದು, ಆ್ಯಂಡ್ ಅವರಿಗೆ ಸರಿಯಾದ ಒಂದು ಹೊಟ್ಟೆ ಹಸು ಆಗ್ತಿರಲಿಲ್ಲ. ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಅವರಲ್ಲಿ ಇರುವಂಥ ಒಂದು ಎನರ್ಜಿ ಕಮ್ಮಿ ಆಗಿರುತ್ತೆ. ಆಮೇಲೆ ನಿದ್ದೆ ಸರಿ ಬರೋದಿಲ್ಲ, ಟೆನ್ಷನ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಆಮೇಲೆ ಅವರ ಲಂಗ್ ಕೆಪಾಸಿಟಿ ಕಮ್ಮಿ ಆಗಿರುತ್ತೆ. ಸೊ ಆಮೇಲೆ ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಈ ಮೈಕೈ ನೋವು ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಜಾಯಿಂಟ್ ಪೇನ್ ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. ಸೊ ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ ಐ ಥಿಂಕ್ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ಈಸ್ ಅವರ ಅಗ್ನಿನ ನಾವು ಸರಿ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗತ್ತೆ. ಸೊ ಯಾಕಂದ್ರೆ ಕರೆಕ್ಟಿಂಗ್ ದ ಅಗ್ನಿ ಈಸ್ ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಎಲ್ಲಿ ತನಕ ನಾವು ಅವರ ಒಂದು ಅಗ್ನಿನ ನಾವು ಸರಿ ಮಾಡ್ಕೊಳ್ಳೋದಿಲ್ವೋ ಅಲ್ಲಿ ತನಕ ಇಂಥ ಒಂದು ಕಂಡೀಷನ್ಸ್ಗೆ ನಾವು ಸೊ ಅಗ್ನಿ ಸರಿ ಮಾಡ್ಬೇಕಂದ್ರೆ ಐ ಥಿಂಕ್ ದ ಬೆಸ್ಟ್ ವುಡ್ ಬಿ ಟು ಗೋ ವಿತ್ ಸಿಂಪಲ್ ರೆಮಿಡೀಸ್ ಲೈಕ್ ಅಗ್ನಿ ಆರೋಗ್ಯವರ್ಧಿನಿ ವಟಿ 1 ಟ್ಯಾಬ್ಲೆಟ್ ಟ್ವೈಸ್ ಡೇ, ಅಥವಾ ಹಿಂಗ್ವಾಷ್ಟಕ ವಟಿ, ಅಥವಾ ಅವಿಪತ್ತಿಕರ ಚೂರ್ಣ, ಅಥವಾ ಪಂಚಕೋಲ ಫಾಂಟ. ಸೊ ಇಂಥ ಒಂದು ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 3 ರಿಂದ 5 ದಿನ ತನಕ ದೀಪನ ಪಾಚನವನ್ನು ಮಾಡ್ಬೇಕಾಗತ್ತೆ. ಆಮೇಲೆ ಇಫ್ ಒನ್ಸ್ ಯು ಫೀಲ್ ಆಮ ನಾವು ಮ್ಯಾನೇಜ್ ಮಾಡಿದೀವಿ ಅಂತ ಅನ್ಕೊಂಡ ಮೇಲೆ ಅವರಿಗೆ ವಿ ಕ್ಯಾನ್ ಆಲ್ವೇಸ್ ಯೂಸ್ ಸಮ್ ಅದರ್ ಪಂಚಕರ್ಮ ಥೆರಪೀಸ್. ವಿರೇಚನ ಕೊಡ್ಬೋದು. ದ ಪೇಷಂಟ್ ಫಿಟ್ ಆಗಿದ್ದಾರೆ, ತುಂಬಾ ಸುಸ್ತಿಲ್ಲ, ಅಂಡ್ ಅವರ ಏಜ್ ಒಂದು 15ರಿಂದ 70 ವರ್ಷ ಮಧ್ಯದಲ್ಲಿ ಇದ್ದಾರೆ, ಪೇಷಂಟ್ಸ್ ಚೆನ್ನಾಗಿದೆ, ಅವರಿಗೆ ಮೃದು ವಿರೇಚನ ಕೊಡ್ಬೋದು ಬೈ ಯೂಸಿಂಗ್ ಸುಕುಮಾರ ಘೃತ ಅಥವಾ ಇಂದುಕಾಂತ ಘೃತ ಸ್ನೇಹಪಾನ ಕೊಟ್ಟು ವಿರೇಚನವನ್ನು ಕೊಡ್ಬೋದು. ಅಂಡ್ ದ ಪೇಷಂಟ್ ಆರ್ ಲಾಟ್ ಆಫ್ ತುಂಬಾನೇ ಸುಸ್ತಿದೆ, ನೋವಿದೆ, ಪೆರಿಫರಲ್ ನ್ಯೂರೈಟಿಸ್ ಇದೆ, ಕೈಕಾಲು ಸುಸ್ತಿದೆ ಅಂತ ಪೇಷಂಟ್ಸ್ಗೆ ಬಸ್ತಿ ಕೂಡ ಕೊಡ್ಬೋದು. ಸೊ ಬಸ್ತಿಗೆ ಸ್ಪೆಷಲಿ ಮಾತ್ರ ಬಸ್ತಿಗೆ ನಾವು ಕ್ಷೀರಬಲ ತೈಲ ಅಥವಾ ಅಶ್ವಗಂಧ ಘೃತವನ್ನು ಯೂಸ್ ಮಾಡ್ಬೋದು ಇನ್ ದ ಡೋಸ್ ಆಫ್ ಅರೌಂಡ್ 70 to 80 ml ಕೊಡುವಂಥದ್ದು. ಅಥವಾ ಇಂಥ ಪೇಷಂಟ್ಸ್ ಬಲ ಚೆನ್ನಾಗಿದ್ರೆ ಇವನ್ ಯಾಪನ ಬಸ್ತಿ, ಮುಸ್ತಾದ್ ಯಾಪನ ಬಸ್ತಿ ಅಥವಾ ರಾಜ ಯಾಪನ ಬಸ್ತಿ ಕೂಡ ಅಥವಾ ಕ್ಷೀರ ಬಸ್ತಿ ಕ್ಯಾನ್ ಆಲ್ಸೋ ಬಿ ಯೂಸ್ಡ್. ಇದನ್ನ ರೆಗ್ಯುಲರ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿ. ಅಂಡ್ ಸ್ಪೆಷಲಿ ಪೇಷಂಟ್ಸ್ಗೆ ನಿದ್ದೆ ಬರ್ತಾ ಇಲ್ಲ, ಸುಸ್ತಾಗ್ತಿದೆ ಅಂದ್ರೆ ಅಂಥವರಿಗೆ ಪೇಷಂಟ್ಸ್ಗೆ ಅಭ್ಯಂಗ ಕೂಡ ನಾವು ರೆಗ್ಯುಲರ್ ಆಗಿ ಮಾಡ್ಬೋದು. ಅಭ್ಯಂಗಕ್ಕೆ ನಾವು ನಿರ್ಗುಂಡಿ ತೈಲ, ಮಹಾನಾರಾಯಣ ತೈಲ, ಕ್ಷೀರಬಲ ತೈಲ ಸಾಮಾನ್ಯವಾಗಿ ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಬೋದು. ದಾರ ಕೂಡ ಪೇಷಂಟ್ಸ್ಗೆ ನಿದ್ದೆ ಅಥವಾ ಸ್ಟ್ರೆಸ್ ಇದೆ, ತುಂಬಾ ಟೆನ್ಷನ್ ಇದ್ದ ಪೇಷಂಟ್ಸ್ಗೆ ಅವರಿಗೆ ಶಿರೋಧಾರ ನಾವು ಉಪಯೋಗಿಸ್ಕೊಳ್ಬೋದು. ಶಿರೋಧಾರಕ್ಕೆ ನಾವು ಸಾಮಾನ್ಯವಾಗಿ ಯೂಸ್ ಮಾಡುವಂತ ತೈಲ ಅಂದ್ರೆ ಕ್ಷೀರಬಲ ತೈಲ ಅಥವಾ ಬ್ರಾಹ್ಮಿ ತೈಲ, ಅಥವಾ ನಿದ್ದೆ ತುಂಬಾ ಕಡಿಮೆ ಬರ್ತಿದೆ ತುಂಗ ದ್ರುಮಾದಿ ತೈಲನ ನಾವು ರೆಗ್ಯುಲರ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೋದು. ಇಂಥ ಪೇಷಂಟ್ಸ್ ನಾವು ಒಂದು ದೀಪನ ಪಾಚನ ಮಾಡಿಕೊಂಡು ಆಮೇಲೆ ಮೃದು ಶೋಧನ ಮಾಡಿದ್ಮೇಲೆ ಅವರಿಗೆ ರಸಾಯನ ಪ್ರಯೋಗವನ್ನು ಮಾಡಬೇಕಾಗತ್ತೆ. ಸೊ ರಸಾಯನ ಪ್ರಯೋಗ ಕ್ಯಾನ್ ಬಿ ಒಂದು ನೈಮಿತ್ತಿಕ ರಸಾಯನ, ಸ್ಪೆಸಿಫಿಕ್ ರೆಸ್ಪಿರೇಟರಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದ್ರೆ ಲೈಕ್ ವ್ಯಾಘ್ರಹಿತ ಕಿಲೇಹ, ಚ್ಯವನ್ಪ್ರಾಶ್ಲೇಹ ಅಥವಾ ಕಂಠಕಾರಿ ಅವಲೇಹವನ್ನು ಕೊಡ್ಬೋದು. GIT ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ ಆಮ್ಲಕಿ ರಸಾಯನ ಅಥವಾ ಗುಡುಚಿ ರಸಾಯನ ಪ್ರಯೋಗ ಮಾಡ್ಕೊಳ್ಬೋದು. ಅಥವಾ ಇಫ್ ದ ಪೇಷಂಟ್ ಹ್ಯಾಸ್ ಸೈಕಲಾಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದ್ರೆ ಮೇದ್ಯ ರಸಾಯನ ನಾವು ರೆಗ್ಯುಲರ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೋದು. ಸೊ ಇದರ ಜೊತೆಗೆ ಪ್ರಾಬ್ಲಿ ಅವರಿಗೆ ನಮ್ಮ ಡಯಟ್ರಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಹೇಳ್ಕೊಳ್ಳುವಂಥದ್ದು, ಮತ್ತೆ ಅದಕ್ಕಿಂತ ಜೊತೆಗೆ ಯೋಗ ಪ್ರಾಣಾಯಾಮವನ್ನು ರೆಗ್ಯುಲರ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಂಥದ್ದು, ಈ ನಾಡಿ ಶುದ್ಧಿ ಪ್ರಾಣಾಯಾಮ ಅಥವಾ ಶೀತಕಾರಿ ಪ್ರಾಣಾಯಾಮ, ಭ್ರಾಮರಿ ಪ್ರಾಣಾಯಾಮ. ಸೊ ಇಂಥ ಪ್ರಾಣಾಯಾಮವನ್ನು ರೆಗ್ಯುಲರ್ ಆಗಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿದಾಗ, ಎಸ್ಪೆಷಲಿ ರೆಸ್ಪಿರೇಟರಿ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದಾಗ ಪ್ರಾಣಾಯಾಮ ತುಂಬಾನೇ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಸೊ ಒಂದು ರೆಗ್ಯುಲರ್ ಆಗಿ ಪೇಷಂಟ್ಸ್ಗೆ ಹೇಳ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಪಾಸಿಟಿವ್ ಆದ ತಕ್ಷಣ ಅವರಿಗೆ ಇಂಥದ್ದೆಲ್ಲ ನಾವು ಸ್ಟಾರ್ಟ್ ಮಾಡಿಕೊಂಡ್ರೆ ಅದರ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಸೊ ಅವರ್ ರೋಲ್ is to prevent the manifestation of COVID-19. ಅದರ್ ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ಕೂಡ ಆ ಪೇಷಂಟ್ಸ್ ಗಳಿಗೆ ನಾವು ಬೇಗ ರಿಕವರಿ ಮಾಡಲಿಕ್ಕೆ ವಿ ಕ್ಯಾನ್ ಹೆಲ್ಪ್ ಥ್ರೂ ಆಯುರ್ವೇದಿಕ್ ಥೆರಪೀಸ್ ಅಂಡ್ ಪ್ರಾಕ್ಟೀಸಸ್. ಥ್ಯಾಂಕ್ ಯು.
Great, sir. So I suppose you have elaborated all the parts of Ayurveda which can be used in post-COVID scenario, ranging from Panchkarma to everything to Naimittik Narasayan to all those parts. Coming back to the question, there are a few doctors who are asking that to brand specific question that ImmuHealth contains Kalmeg, Ashwagandha, Tulsi, Giloy, Yashti Madhu. So is there any contraindication in terms of usage of Ashwagandha and say Yashti Madhu for a diabetic patient or for a hypertensive patient? Can we use this particular combination in these conditions? And is there any time limit for which we should stop, or what should be the duration of prescribing those medications? Again, my request is, since we're short of time, you please mention the very crux and in Kannada, because again we are not able to converse these parts into that particular piece.
Yeah, yeah. ಸೊ ಸಾಮಾನ್ಯವಾಗಿ ಅವರ ಹೇಳಿದಂಥ ಏನು ಕ್ವಶನ್ಸ್ ಇದೆಯಲ್ಲ, ಒಂದು ಖಂಡಿತ ಇದ ಇದರಲ್ಲಿ ಇರುವಂಥ ಒಂದು ಇಂಗ್ರೀಡಿಯೆಂಟ್ ಏನಿದೆ ಅಶ್ವಗಂಧ ಮತ್ತೆ ಕಾಲಮೇಘ, ದ ಡೋಸ್ ಇಸ್ ವೆರಿ ಸ್ಮಾಲ್. ಇಟ್ ಈಸ್ ಓನ್ಲಿ 250 mg ಆಫ್ ಅಶ್ವಗಂಧ, then 100 ml, 200 mg of kalamega, and amalaki, guduchi, and they're all in the dose of around 50 mg. ಸೊ ದ ಡೋಸ್ ಏನಿದೆ ಅದು ತುಂಬ ಜಾಸ್ತಿ ಏನು ಇರೋದಿಲ್ಲ. ಬಟ್ ಏನಂದ್ರೆ, ಸೊ ಇಂಥ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಒಂದು ನಾವು ಏನು ಮಾಡಬೇಕು ಅಂದರೆ, ದ ಪೇಷಂಟ್ ಹ್ಯಾಸ್ ಹೈಪೋಟೆನ್ಷನ್ ಇದ್ರೆ ಅಥವಾ ತುಂಬಾನೇ ಪೇಷಂಟ್ ಹ್ಯಾಸ್ ಅ ಡಿಸ್ಟರ್ಬ್ ಸ್ಲೀಪ್ ಇದ್ರೆ, ಸೊ ಅಂಥ ಪೇಷಂಟ್ಸ್ಗೆ ತುಂಬ ಲಾಂಗ್ ಆಗಿ ಕೊಡೋದಕ್ಕಿಂತ ಶಾರ್ಟ್ ಪೀರಿಯಡ್ ಆಫ್ ಟೈಮ್, ಶಾರ್ಟ್ ಪೀರಿಯಡ್ ಅಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 4 to 6 ವಾರಗಳನ್ನ ತನಕ ಯೂಸ್ ಮಾಡಿದ್ರೆ ಉತ್ತಮ. ಸೊ ಕೆಲವೊಮ್ಮೆ ಏನಾಗುತ್ತೆ, ಆ ಕಾಂಬಿನೇಷನ್ ಎಲ್ಲರಿಗೂ ವರ್ಕ್ ಆಗುತ್ತೆ ಅಂತ ಹೇಳೋದಿಲ್ಲ. ಈ ಕಾಂಬಿನೇಷನ್ ಯಾರಿಗೆ ನಿಮ್ಗೆ ಹೆಲ್ಪ್ ಆಗ್ತಾ ಇಲ್ಲ ಅವರಿಗೆ ನೀವು ಅವರ ಒಂದು ಕಂಡೀಷನ್ ನೋಡಿಕೊಂಡು ನೀವು ಅದನ್ನ ಖಂಡಿತ ಮಾಡ್ಕೊಳ್ಬಹುದು. ಸೊ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ದಟ್ ಯು ಶುಡ್ ಆಲ್ವೇಸ್ ರಿಮೆಂಬರ್ ಇನ್ ದ ಯೂಸೇಜ್, ಒಂದು ಹೈಪೋಟೆನ್ಷನ್ಗಳಿಗೆ ಜಾಸ್ತಿ ಲಾಂಗ್ ಟರ್ಮ್ ಯೂಸ್ ಮಾಡಬೇಡಿ. ಇನ್ನೊಂದು ಏನಂದ್ರೆ, ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಯಾವಾಗ ನಿಮಗೆ ರೆಗ್ಯುಲರ್ ಆಗಿ ಕಂಡು ಬರುತ್ತೆ ಅಂತ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ನೀವು ಒಂದು ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 4 to 6 ವಾರ ತನಕ ಕೊಟ್ಟು ನೋಡಿ. ಅದರಲ್ಲಿ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಅಷ್ಟು ರಿಸಲ್ಟ್ ಸಿಗ್ತಾ ಇಲ್ಲ ಅಂತ ಯು ಶುಡ್ ಆಲ್ವೇಸ್ ಟ್ರೈ ಟು ರೀಇವ್ಯಾಲ್ಯೂಯೇಟ್ ದ ದೋಷಿಕ್ ಮ್ಯಾನಿಫೆಸ್ಟೇಷನ್, ಯಾಕೆ ಅವರಿಗೆ ಅಷ್ಟು ರಿಸಲ್ಟ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ಅಂಡ್ ಸ್ಪೆಷಲಿ ಇಂಥ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ ಬರೀ ಶಮನ ಔಷಧಿ ಹೆಲ್ಪ್ ಆಗ್ಲಿಕ್ಕಿಲ್ಲ. ಸೊ ಅಂತ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಶೋಧನೂ ಬೇಕಾಗುತ್ತೆ, ಅಥವಾ ಅಟ್ಲೀಸ್ಟ್ ಮೃದು ಪಂಚಕರ್ಮ ತರದ ಬಾಹ್ಯ ಪಂಚಕರ್ಮ ಅಥವಾ ಅಭ್ಯಂತರ ಥೆರಪೀಸ್ ಬೇಕಾಗತ್ತೆ. ಅಂತ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ನೀವು ಯು ಕ್ಯಾನ್ ಆಲ್ವೇಸ್ ಆಸ್ಕ್ ದೆಮ್ ಟು ಗೋ ವಿತ್ ಡಿಫ್ರೆಂಟ್ ಟೈಪ್ಸ್ ಆಫ್ ಥೆರಪೀಸ್. ಸೊ ಒನ್ ಆಫ್ ದ ಐಡಿಯಲ್ ದ ಡ್ಯೂರೇಷನ್ ನೀವೇನು ಮೆನ್ಷನ್ ಮಾಡಬೇಕು ಇಸ್, ಐಡಿಯಲಿ ಯು ಶುಡ್ ಬಿ ಏಬಲ್ ಟು ಗೆಟ್ ದ ಬೆಸ್ಟ್ ಬೆನಿಫಿಟ್ 4 to 6 ವಾರ ತನಕ ನಿಮಗೆ ಅದರ ರಿಸಲ್ಟ್ ಸಿಗ್ಬಿಡುತ್ತೆ. ಇನ್ನೊಂದೇನಂದ್ರೆ, ಇಫ್ ಇಟ್ ಆರ್ ನಾಟ್ ಗೆಟಿಂಗ್, ಯು ಶುಡ್ ರೀಕನ್ಸಿಡರ್ ದ ಡಯಾಗ್ನೋಸಿಸ್ ಅಂಡ್ ದ ಪರ್ಮುಟೇಷನ್ ಅಂಡ್ ಕಾಂಬಿನೇಷನ್. Any more questions? Yeah. Dr. Ashutosh, do you have any more questions to be taken up for the... So I kindly request you all to kindly give your valuable feedback at my email ID, drsuhashetty@gmail.com. So I once again thank the organizers for this wonderful opportunity, and it has been great being organized for this webinar, and kindly contact and give your valuable feedback. So thank you very much.